DocTalk, brought to you by the Beef Quality Assurance Program and the Kansas Beef Council, improving animal care and beef safety for more than 20 years.
Hi there and welcome to Doc Talk. I'm Dr. Dan Thompson here at the College of Veterinary Medicine at Kansas State University, and this is the first of a three-part series where we're going to discuss central nervous system disorders that lead to down cattle. We're going to talk about the potential treatment and care of those animals in the second segment, and the third segment is going to be when these treatments don't work and we have to humanely euthanize an animal. So I think it's really important because the down cow or the animal with central nervous system disorders has been in the media. It seems to be the thing that we see when we have mismanagement of these down cattle, winds up on video clips and undercover video clips. And I think it's very important not only for producers to understand what causes down cattle, how to properly treat these downed animals, and how to humanely euthanize them or make the decision to humanely euthanize them, but it's also important for consumers to understand that we have syndromes and illnesses and different things that go on within cattle that are similar to what go on in humans. And when we think about the downed animal, we have two types of downed animal, an alert or morbid downed animal. And an alert downer is one that is alert to its environment, can sit up, can drink and eat, and a morbid one is that's out flat and it's non-responsive to its environment. So when we think about treatment, we'll think about those two. But let's talk about the causes of what potentially may cause a non-ambulatory animal or cause an animal to be ataxic or not be able to, to stumble or cause blindness. All of these central nervous disorders or peripheral nervous disorders can be an issue. The central nervous system is made up of the brain and the spinal cord, and then the nerves that come out from there to the limbs and to the visceral organs are what we call peripheral nerves. And as we have bacterial, toxic, or toxin ingestion or consumption, or if we have injury to an animal, all of these can damage nerve cells, whether it's in the central nervous system or whether it's within the peripheral nervous system. Regardless of where the lesions are, all of these types of issues have the potential to cause an animal to be non-ambulatory or not be able to stand up or not be able to move or walk appropriately. And these animals must not enter the food chain. These animals that are non-ambulatory through the Downed Animal Act cannot be dragged, cannot be transported, and these animals by law do not enter the food chain. The issue that we have is identifying and preventing the causes of these issues. We also need to understand how to treat these animals so that they can recover, and then what happens when it doesn't go right. As we move through these segments and as we talk today, we're going to talk about bacterial and viral infections that can cause downed animals. We're going to talk about ingestion of potential toxins, and these aren't like toxins like that you'd think. We're just talking about sulfur, lead, and salt. And then the last thing we're going to talk about today is potential injury. When we come back in the next segment, we're going to talk about treatment and intensive care, and we're sure glad you joined us. This is an important subject for all of us to be aware of, and I think it's something that's valuable for the producer, and I'm glad we're going to be able to share it with you. Thanks for watching, and I'll see you here after the break.
Doc Talk, brought to you by Kansas Pork Association, assisting producers and informing consumers.
Hi there and welcome back to Doc Talk. Dr. Dan Thompson here from the College of Veterinary Medicine at Kansas State University. As we left for break, we were discussing the causes of central nervous or peripheral nervous system disorders in cattle. And the two biggies on the infectious side of things that I want to discuss are Histophilus somnus and Listeria monocytogenes. Now, when we talk about Histophilus, and you think, well, what's Histophilus? Histophilus, for most producers, they'll be familiar with the term Haemophilus somnus. And Histophilus somnus is the new name for Haemophilus. And when we think about Histophilus or Haemophilus, generally we think of that as a bovine respiratory disease pathogen. However, Histophilus can also cause joint ill in calves and cause lameness in calves, but it can also cause central nervous system disorders in the brain through thromboembolic meningoencephalitis. Now that's a mouthful. But what TEAM is a plaque or an embolism of the Histophilus bacteria on the brain level, which can elicit clinical signs such as salivation, ataxia, and cause the animal to go down, and it can cause moribund animals or death. And the other bacteria that we want to talk about that can cause central nervous system disorders is Listeria monocytogenes. And Listeria, you'll know the kind of the layman's term for Listeria is circling disease. Listeria is a gram-positive bacteria that grows in the soil, that also grows in the in rotten vegetation such as old hay or can grow in some improperly fermented silage. And Listeria on circling disease will cause a plaque on the brain on the left or the right side, and whichever side that plaque or infection of Listeria forms, the animal will circle towards that side. Listeria in later forms can cause the animal to go down and be morbid. Now, where is Listeria? We talked about it being in the silage, being in old hay, but it a lot of times can be in a silage pit. And Listeria doesn't happen very often, and I haven't seen very many cases, but whenever we do, and we go to the silage pit to try to find the Listeria, we don't tend to find it. Part of the reason is that within the silage pit, you can get air pockets or pockets where we get improper fermentation. Within that, when we don't get proper fermentation, is when we can get pathogens like Listeria to grow instead of the good bacteria that are fermenting the feed. And when we go to test for it, what I think happens is that we feed through that pocket of Listeria, and by the time we realize we have a problem, we're to the part of the silage pit that was properly fermented. So it's really important for the prevention of Listeria to make sure that we have proper fermentation, we make sure we have good moisture levels on that silage, make sure we get a good anaerobic pack so that we get a good fermentation within the silage pit. As we move forward from some of these infectious agents, and of course with infectious agents, when we talk about treatment, we're going to talk about some antimicrobials that can treat these problems. When we come back from break, we're going to start to talk about some of the toxins that can cause central nervous system disorders, which then potentially lead to down cow. You're watching Doc Talk, and we're sure glad you joined us.
Doc Talk, brought to you by the Beef Quality Assurance Program and the Kansas Beef Council, improving animal care and beef safety for more than 20 years.
Hi there and welcome back to Doc Talk. I'm Dr. Dan Thompson here from the College of Veterinary Medicine. We've been talking about things that can potentially, whether it's infectious, toxins, or injury, cause a down cow or a central nervous or peripheral nervous disorder. And we talked about bacterial causes. Now in this segment we're going to talk about some of the toxic issues. And we think about toxins, it's not like chemical substances. We're thinking about naturally occurring elements such as sulfur and lead and salt. Let's start out with sulfur. Polioencephalomalacia is a syndrome that we term polio in calves, and polio issues can stem from one of two things: either a decrease in thiamine, which is a B vitamin, or an increase in sulfur or sulfate ingestion. Cattle produce B vitamins on their own through rumen microbes in the rumen. And so generally we don't supplement thiamine, which is a B vitamin, to cattle because they're producing their own. However, if we have an acidosis issue or a rumen dysfunction issue where we don't have microbial fermentation at a high enough level, there could be a potential decrease in thiamine production. But most of the polioencephalomalacia, the cases that we see, are due to increase in sulfur ingestion. And that can be from water, which we measure the sulfates. It can be through feed products that have high sulfur content, or in the use of byproduct feeds that we feed with the distillers grains and some of the gluten feeds. We have elevated sulfur levels within those feedstuffs. Now, polio issues occur more in the summer than they do in the winter, spring, or fall, especially if we have high sulfate levels in the water. This is due to the fact that cattle drink 5 times their dry matter intake in the summer, and they drink 3 times their dry matter intake in the spring, winter, and fall. So the increased drinking water intake of cattle in the summer can cause more polio issues to erupt in the summer. Make sure you check the sulfate levels of your feed. Make sure you check the sulfur levels of your feed. Make sure you check the sulfate levels of your water and work with your veterinarian to make sure you aren't creating these types of issues. Lead toxicity. We seem to see lead toxicity in cows out on pastures, and when we see that, the two main culprits of the sources of lead are, one, unused oil or leftover oil that cows get into, or a battery. Cows tend to go to a junk pile and they can sniff a battery out from a mile away, and I don't know if it's the sulfuric acid from the battery or what, but they like to lick them and chew on old batteries. And the clinical signs, one of them is to find the cow dead. The other one is a cow that's salivating, one that's constipated. It can cause GI issues, it can cause central nervous system issues, but one that's not walking appropriately, one that's moon gazing or over salivating. These are common clinical signs of lead toxicity. In feed yards, we want to make sure that we don't use lead-based paint when we paint pipes. Cattle will chew on pipes, they can get flakes of lead-based paint. And remember this, that if you have a cow or a steer that succumbs to lead poisoning, those animals need to be condemned and they don't enter the food chain because of the lead toxicity. Get your veterinarian to help you diagnose it, though, to make sure that you know what you're dealing with on these. And as we come back from the break, we'll wrap up with a little bit of the toxins and we'll move towards some of the trauma issues on down cows. You're watching Doc Talk, and we're sure glad you joined us.
Doc Talk, brought to you by Kansas Pork Association, assisting producers and informing consumers.
Hi there and welcome back to Doc Talk. I'm Dr. Dan Thompson here at the College of Veterinary Medicine, and we're talking about the downed animal and problems with the central nervous system disorder. One of the toxins I failed to mention was salt toxicity, and salt toxicity can be created when an animal consumes salt without having a hydration or being able to use the water supply adequately. And we need to make sure that animals know where and how to get a drink if we're going to be providing free choice salt. Some of the things on trauma, and I have some of them written down here, that I want to talk about that can cause an animal to go down, but the number one is calving. Okay? Cows that have trouble delivering a calf normally or need assistance in delivering a calf can sometimes go down in the back end. And the reason why this happens is the pelvis canal is made up of bone. And there's no give to bone. And so if we have too big a calf or too small a pelvis, we need to be working with our veterinarian. We need to be looking at doing a cesarean section, because if we have too much pressure of a hard pull of bringing that calf through that pelvic canal, we have obturator nerves that come from the spinal cord that go out the bottom of that pelvis through the obturator foramen. The obturator nerves are the nerves that cause the innervation or the movement of the hind limbs. When we get too much pressure of a hard pull from a calf going through that pelvic canal, we can cause disruption of the obturator nerves, and that's when we get those cows that go down in the back end. And some of them, through tincture of time and some treatment, can rise again, but some of them never get back up. Really focus on making sure that you have enough room if you're going to pull these calves yourself. And the other one, if you have any question, make sure you get your veterinarian on the farm to help you make that decision. Banding calves sometimes can cause a central nervous system disorder called Clostridial tetani, and tetanus, as what we know. And we really need to make sure that when we're banding calves, that you vaccinate the calves or use an antitoxin for Clostridium prior to banding, when we band to castrate these animals. And the last one is severe lameness. And this is the thing that a little bit of lameness left untreated or not looked at with that cow can turn into severe lameness, which can then cause that animal to become non-ambulatory. Get on top of lameness cases right away. Get your veterinarian involved. Understand what's going on. Pick that foot up. Understand if it's foot rot, toe abscesses. It could be founder. Any of these types of things can lead to severe lameness, and we need to make sure we get on top of these either on your own through diagnosis and treatment, but definitely consult your veterinarian. Thanks for watching Doc Talk today. I sure hope you enjoyed the show. Remember, we always want you to work with your local veterinarian. Also, if you want to know more about what I do here at K-State, you can find me on the web at www.vet.ksu.edu. Also, you can learn more about DocTalk if you go to www.doctalktv.com. Thanks for watching the show. I'm Dr. Dan Thompson here from the College of Veterinary Medicine at Kansas State University. Thanks for joining us, and I'll see you down the road.